Welcome back to another episode of Novus News. I'm Stephanie Wolff, PA and CEO of the Novus Center here in Studio City.
And I'm Jada Pasquale. I'm the registered nurse here at the Novus Center.
So today we are talking about what is cellulite. Huge question. Everybody always asks, what is cellulite? Let's start with two specific things that cause cellulite. Cellulite really is a herniation of these fat cells, or what we like to call adipocyte. It's also fibrosis of the cords that attach the top layer of the skin to the bottom layer of the muscle. So if you guys can just visualize it for a second, you've got your skin, and then below your skin is your fat cells, and then below your fat cells is your muscle layer. And you have these little cords, what I like to call fibrous cords, and they connect the skin to the muscle layer, which is just how it all attaches. And over time, these fibrous cords can have some scar tissue to them, and they can shrink or they can calcify. And so that's basically pulling on that top layer of the skin and protruding out those adipocyte cells or fat cells. So really that's what cellulite is. And it's this kind of lumpy and bumpy that's actually created by these fat cells because of the shrinkage of the cords.
Right, and like adding on to you about how these fat cells are protruding through the herniations, it's actually all comes down to the structure of the connective tissue. For women, we tend to have our fibrous bands in a vertical way, and for men, they have it in a crisscross structure. So it's almost impossible for them to really get fat protruding through those connective tissues.
In fact, all the studies I was reading showed that 80% of cellulite is actually in women over the age of 20. That's crazy. Over the age of 20? What is happening? Why is this happening?
They don't even have to be fat too.
Yes.
It can be very skinny women who work out and eat healthy too.
So why is that? Why, what are some of the reasons why cellulite is happening, let's say to these young girls, who, let's say they exercise and they eat well and they're doing all the things. Why do they get cellulite?
Well, number one thing, it all comes down to genetics too. I have a patient here that she's not
overweight.
No.
No. In fact, she exercises a little too much, but we're not going to judge her right now.
She eats healthy. She's really, really adamant about her daily lifestyle. And she talks about how back then when she was younger, she was a lot heavier, but she didn't really see cellulite back then. So as you age, the skin thins and it just becomes less elastic. So as she ages, more fat cells are going through those connective tissues that are vertical and just showing more lumpiness.
Too, I know that she mentioned to me that her mom had a lot of cellulite as well. So, I think genetics can play a key role. Something that I see here a lot at Novus, because I do a lot of hormone balancing, is my postmenopausal or perimenopausal women. As their estrogen and testosterone start to decline, they'll also start to see cellulite. And the reason is estrogen and testosterone are both very potent vasodilators. So what that means is they actually open up the blood vessels and they're allowing that rich oxygenated blood to the tissue. And as you guys know, if you're feeding the tissue rich oxygenated blood, then the tissue is going to be healthy. It's going to grow more collagen, it's going to be more plump, it's just going to be happier skin. So, the reason why we're seeing more and more cellulite in these postmenopausal women is because they're lacking in estrogen and testosterone, so they're reducing their blood flow, which means they're no longer feeding their tissue, which means their tissue is starting to atrophy or die off, which means that they're losing their collagen, and then their skin becomes thinner.
Yeah.
So then you're having that protrusion of the fat cells. I want to mention too, smoking. Smoking is also a really potent vasoconstrictor. So if you are smoking, you're not allowing that blood to flow to the tissue. Again, you're not feeding that tissue. So then the tissue is going to die off and your collagen is going to die off. And then again, that skin is going to be thin. And that's what's going to allow that protrusion of those fat cells or the adipocytes. And again, we talked about when they're protruding, they're going to start to pull on those fibrous cords.
Right. Right.
And we were kind of talking about this for a second, and some of you guys may know this or not, but if you think about trigger finger or Peyronie's, it's the same idea.
It pulls back.
It pulls back. So these cords, they become inflamed and they start to shrink and retract. And then that's why with trigger finger, you'll see patients, usually it's their fourth finger, but it starts to kind of curve and they'll have to kind of massage, that little tendon to get that finger back.
It's very tense in that area.
Exactly.
Yeah.
So if you can visualize a trigger finger, and that's exactly what's happening, with the fibrous cords underneath the skin, of course you're going to have that protrusion. So, so hopefully that answers what is cellulite for you guys. Stay tuned for another episode.